So once again, my name is Dean Frohlich, and I'm the Scientific Review Officer at the Concord Cancer Foundation, and I'll talk to you for a few minutes about our grants programs. So as of 2017, we have awarded more than $111 million in funding through more than 1,800 grants and awards in 71 countries. Here you can see our funding as we've gone on through the years, beginning in 1984. This year, we were able to award almost 100 grants and awards. With the addition of our Global Oncology YIA. So we have 5 different types of career development grants now, and 2 types of grants that are specifically for international international investigators. We have other awards as well for underrepresented populations in medicine. The medical student rotation provides clinical or clinical research oncology rotation, plus funding to travel to the ASCO annual meeting. This year we received 14 applications and funded 7 of them. In addition, the Resident Travel Award supports residents from underrepresented populations to attend the ASCO annual meeting. And this year we received 16 applications and awarded 6. For researchers from low and middle income countries, we have the International Development and Education Award. This provides support for early career oncologists in low and middle income countries. Recipients of this award attend ASCO's annual meeting and participate in a post-meeting visit to their mentor's institution in the U.S. or Canada. Recipients of this award also receive 3 years of complimentary ASCO membership, including a subscription to the Journal of Clinical Oncology. This year we reviewed 135 applications and were able to fund 20 of them. For our international awards, the Long-Term International Fellowship provides early career oncologists in developing nations the support and resources needed to advance their training by deepening their relationship with an investigator in the United States, Canada, or Europe, and his or her institution. The fellowship is a 1-year, $115,000 medical fellowship. Recipients must return to their home institutions after completing their international fellowship and are expected to disseminate the knowledge they have gained. They're a combination of clinical training and clinical and laboratory research. This year we reviewed 13 applications and were able to fund 1 of them. The International Innovation Grant is one of our newer grants. Since 2014, we've been able to support 20 novel and innovative projects in 12 low and middle income countries. The grant is designed to innovate to stimulate innovative cancer control solutions for low resource practice environments. It's a 1-year, $20,000 grant. Recipient organization must be based in a low and middle income country. The potential areas of study for this are health services and delivery research, new models of clinical training, delivery of palliative care, amongst others. This year we received 66 letters of intent, 28 of which were invited for a full proposal, and 3 of which were funded. For our career development grants, first I'll start with the research professorships. These are topic-specific competitions designed to provide flexible funding to outstanding researchers who have made and are continuing to make significant contributions that have changed the direction of cancer research and who provide membership to junior researchers. The Advanced Clinical Research Award This is a topic-specific competition as well. It is designed to fund investigators who are in their 4th to 9th year of full-time faculty appointment in a clinical department at an academic medical institution at the time of application. Past topics have included breast cancer, colorectal cancer, hematologic malignancies, lung cancer, and glioma. This year we were able to fund 1 ACRA in breast cancer. The research must have a patient-oriented focus, including a clinical research study and/or translational research involving human subjects. Proposals with predominant focus on in vitro or animal studies, even if clinically relevant, are not allowed. Our Career Development Awards. Since 1992, we have awarded 267 Career Development Awards, 36% of which are past YA recipients, and this totals more than $49 million. This year, we received 74 applications and funded 15 of those applications. The CDA is a 3-year grant totaling $200,000. The applicant must be a physician, a medical doctor, a DO, or international equivalent who is within the 1st to 3rd year of full-time primary faculty appointment in a clinical department at an academic medical institution at the time of grant submission. Faculty appointment may begin with entry-level faculty position within the applicant's institution. So oftentimes for the purposes of this award, instructor positions are included in that primary faculty appointment. Grant applications from candidates with existing career development awards, such as a K-23, K-08, or other type of career development award, are not considered. We do not allow overlap with our Young Investigator Award. So Young Investigator Award recipients who apply for the Career Development Award must be done with their Young Investigator Award if they get award or are awarded a Career Development Award. This award is open to all subspecialties in oncology research, and it must be clinically based. The request for proposal will be available in June on our website, which I'll put up in a little bit. So ASCO's definition, so the CDA is intended to have a patient-oriented focus, including a clinical research study and or translational research involving human subjects. So here's the definition that ASCO uses. It is also in our request for proposal, so if you're interested, if your potential application falls within our guidelines, you can go there. Proposals with a predominant focus on in vitro or animal studies, even if clinically relevant, also are not allowed. So the Young Investigator Award is our largest program. The purpose of the YIA is to fund physicians during the transition from a fellowship to a faculty appointment. It's a 1-year grant totaling $50,000 with a mandatory mentorship requirement. The applicant must be a physician, an MD, DO, or international equivalent who is currently within the last 2 years of their fellowship or subspecialty training at an academic medical institution and within 10 years of his or her medical degree at the time of submission. There are some instances where we can be a little lenient with that, but for the most part you have to be awarded your MD within the last 10 years. As you'll see in the next slide, all subspecialties of oncology research are also granted here. In 2018, we had 238 applications, and we funded 72 of them. Like with the CDA, the request for proposal will be available in June. So you can see here, this is the subject areas by annual meeting track of all of the grants that we've given out since 1984, or the YA and CDA. You can see the top 5 subject areas. However, also you can see that there's a wide variety of grants in all subspecialty areas that are given out. Last year was our first year with the Global Oncology Investigator Award. This grant is to provide research funding to early career investigators to encourage and promote quality research in global oncology. It's a 1-year, $25,000 to $50,000 grant. The intent is to fund researchers in 3 different scenarios. First, research by investigators in low and intermediate resource settings on scientific questions specific to those settings, or research by investigators in high resource settings on issues in limited resource settings. And then thirdly, collaborative research where a high and a low or intermediate research investigators collaborate on questions of shared concern, such as studying a cancer type that affects a small population in the United States but is common in another country. This year we received 43 applications for this award, and we were able to grant 7 awards. Applicants are encouraged to be innovative. Subject areas could include but are not limited to clinical and translational research, innovative care delivery, prevention and palliative care, implementation research, and health systems. So how to apply to our grants? The applications open on July 1st of this year. They will close on September 21st. Oops. You can go to our grants portal at grants.concord.org. You can download the RFPs at the following links. Late applications are not considered, so please don't email us on the night of the 21st saying, can I have a couple of days of extension, because we can't do that. As has been iterated over again with many of the talks today, do not wait until the week before the due date to begin these. As they have said, it requires institutional documents to be uploaded, mentor documents to be uploaded, and that does not work well when it's done too late. So I'd like to go over some common YA and CD application problems. You'll have heard some of these before. Feasibility issues, no drug or approval from the sponsoring company, absent a collaborator or no letter of support from that collaborator. It's overambitious and does not fit the grant timeline. This happens multiple times on a yearly basis. The applicant's role in the project is unclear. When writing your grant, be sure to indicate specifically your role in developing the application. Oftentimes we'll hear that it looks like a grant that has been submitted by the mentor. It looks very much like that, and that puts in doubt, your role in developing this application. The mentoring plan, some still do not have a mentoring plan in their application with the mentor's letter. Once again, do not follow the RFP, not clinical, no biostatistical plan. We have a biostatistician reviewer that reviews every application of the Young Investigator Award, Clinical Development or Career Development Award, and Advanced Clinical Research Award. So it's imperative that you have a strong biostatistical plan. And more, we are including an advancing patient-focused research section, For the Career Development Awards, we have patient advocate reviewers on each application that contribute a score to that. We also have a section in the Young Investigator Award where a question is asked, how is this going to be relevant for patients in the near-term future? And the reviewers are asked to take that into strong consideration. So it is imperative that you think through and indicate how this is going to affect the patients and answer the questions specifically. The Career Development Award has 4 or 5 questions that we ask you to answer. The application is not clear and concise. And then institutional support, weak letters of support. This goes to Dr. Thomas's talk. Be sure that when conferring with your support, your mentor, your institution, and collaborators, that you have them or help them write a strong letter of support. And as we had heard earlier, we get feedback a lot of times from reviewers where the application seems to be cut and pasted from another application. So if you have any questions, please email us at grants@concord.org. Please fill out the grants writing workshop survey. Oops. We have paper copies at the back. You can go to surveymonkey.com/r/783D7WR, or you can scan that. I'll go back again. You can scan that QR code, and that will take you to our survey so that we can help make the workshop a little bit better every year.